Right, into those COVID numbers. It's 20 minutes past 7. The NICD recording 11,125 new COVID-19 infections and 1 death in the latest 24-hour reporting period. The increase represents a 23.8% positivity rate with over 83,000 active cases in the country currently. Gauteng remains the epicentre of COVID-19 cases as it reported close to 8,000 cases in the last 24 hours. Now, this follows last week's announcement by South African scientists on the detection of the new COVID-19 variant Omicron in the country, which resulted in a number of travel bans against southern African countries. To talk more about the current COVID-19 situation, we are joined by medical expert and CEO of Higher Health, Professor Ramneek Ahluwalia. Prof, good to have you. Thanks very much for joining us here on the program.
Morning, Leanne. It's an absolute honor. Thank you very much.
So we're seeing the cases rising on a daily basis. Obviously, the weekend, we always see a bit of a slowdown and then suddenly it accelerates. What is your interpretation into this fourth wave, which I imagine we can officially say we're in? Well, certainly some provinces.
We're definitely in the fourth wave. As you rightfully said, there are actually 4 variables that are defining our fourth wave, Leanne. The one is what you've just spoken about, that's Omicron, and there are 3 other variables that we must speak about that will actually decide the trajectory of our fourth wave and how severe the fourth wave will be in reality. So definitely Omicron is a variant which has clearly shown that it is highly transmissible. It's now extremely contagious compared to its sister variants that we saw, which was Delta, Beta, and the original coronavirus that caused our first wave. And what we're also seeing is Omicron has shown through its mutations, because we've seen about so many mutations in the same variant, that is showing something we always spoke about called the escape mutations, which means that there's high possibility of reinfections happening. As we all know that 70% of South Africans somewhere got infected with COVID-19, either during the first wave, the second wave, or the third wave. So which means that immunity weans down and this new variant starts showing some escape mutations and reinfections are happening.
Yeah.
What we also see from the early data is that this new variant also has something called escape mutations for even our vaccine immunity, not to the level of severity of a disease and not to the level of deaths, but yes, through breakthrough infections, which are highly possible and which are happening. So this is a new variant, which is one big variable causing our fourth wave. But there are 3 other variables, and the second one is behavior. If you really look around you really look around where things are, it's still an airborne disease. It still spreads from one person to the other, and it's still a variant that is exactly what coronavirus was. But the reality is the guarding mechanisms which we placed, which was masks, physical distancing, open ventilation, not having crowds. And what has happened is there's a lot of COVID fatigue, which is totally understandable, a feel for everyone around, and people believing that when we go home and when we meet our parents or meet siblings over family dinners of the weekends, there's no need for masks because these are the people we trust.
Yeah.
But reality is there are children going to schools, people going back to work, and there is a lot of community spread when the virus is such high transmissible. The third variable is young people. The virus and adolescents. This virus is now showing absolute affinity to the youth. And where the youth is where they are highly fragile, lot of intermingling. They are in schools, they are in institutions of higher learning, and that's where the community spread takes another turn, specifically when the virus loves the young body and it loves to move from one individual to the other. And the last is vaccination. So imagine a non-vaccinated young person who's not keeping the guard of wearing the norms of wearing the mask or social distancing or the behavior. And that's where we find ourselves, South Africa, a country which is a young country, a population which is the biggest population remains the young people. And that's where we find ourselves, and that's what we need to change if we have to define this book.
Yeah, indeed, and of course, this is the festive season. This is the time where people get together, they party, they celebrate. It's Christmas coming up, it's New Year's coming up, it's all of these kind of festivities that people are wanting to get together and enjoy other people's companies. But I know the alarm bells are certainly there. Do we know more about this variant? I know we keep on hearing that this may not be as vicious as past variants, particularly the Delta variant, that it might be a lot milder, that it is not causing as many hospitalizations and deaths as previous ones. Are we getting closer to confirm this speculation, or these speculations, I should say?
Leanne, yes and no. Why yes? Because there is a 1 to 1.5 weeks of clear data in front of us, which is giving us an indication. So you're absolutely right. Omicron is a variant where we've seen about 30 plus mutations. It's something which we have never experienced in the scientific world from another previous variants, including the biggest one we saw was Delta, where the transmissibility was extremely high, and we also saw virulence in this virus, which obviously killed a lot of people and hospitalized many people. On the other side, the early trends, as much as the early trends always come from young people. And young people, we already know, have something called, because as we already say, 70% of South Africans have either got COVID from the first, second, or third wave, which means they had inbuilt immunity somewhere. And then you are young people who have more immune system strengthening to not let the viral load overtake your body, and your immune system overtakes it, which means you do end up getting mild to moderate infections. The reality will be tested when a non-vaccinated older generation or non-vaccinated young or people with comorbidities will be tested around this variant. At this moment, definitely, it seems to be that the Omicron variant has slightly reduced its virulence, which is a very good sign for South Africa and for the world. But there is also two more factors that are playing. One is that we have, at this moment, a large population among the age which is above 40, above 50, and above 60 who are vaccinated. We're looking at about 50% and above people who are vaccinated. In the younger people, we're looking at the natural immunity and about at least 25% of the population now vaccinated. So we're looking at that vaccine immunity, which is preventing the early signs that are given. The second thing, what we are also looking at is the factor that older generation, it's only now that they are now getting infected with this new variant, because it has now formed what we call it as a community spread. Yeah. So it was very much from the first week, a lot about the young people, the adolescents, but now moving gradually into the old people.
Okay.
But yes, no red alerts.
Yeah. Prof, as I let you go, there's been many predictions that this is going to see caseloads even higher than Delta. Obviously, the weekend we saw a little bit of a slowdown because it's just normal. That's just the way things are. But in terms of predictions for infection rates, are we going to see levels that we've never seen before in the country?
Absolutely. This is a highly transmissible virus. Even, and some studies are showing as high as 30 times more than even a Delta variant. So if we look at the third wave, which obviously spiked more than even a second wave, which was because of Beta, this is going to it's already surpassing what our levels of transmissibility were when the other waves started. Our waves are not starting like a bell curve. It's starting straight like a mountain in front of us. But as I said clearly, as much as the infections are high, it's highly contagious. But if the immune system of the body and the virus virulence is slightly lower, then we are looking at milder to moderate infections, still less hospitalization than we are still expecting. What we've seen from the early data, less good, but doesn't mean that people won't die. Even a few people will die, still people will die. Okay. And responsibility not to make that happen.
Prof.
So this is a disease which is slightly lethal.
Prof, I need to very quickly end this interview, and if you can do this answer for me short. It's an important question, but I don't know how long you need to answer it. That's the problem. I saw a report coming out, and it was talking to an article coming out, talking to the fact that seeing this Omicron and the fact that it is not as vicious as previous ones could be the first indication that COVID is finally sort of weaning. I see a smile on your face. It is the first signs that this could be the start of the end of COVID. Is this too early to even talk about something like that? People bringing in comparisons with the Spanish flu and this. Would you like to comment on that very quickly?
Again, answer is yes and no. Why yes? Because you're right, Leanne. But if you compare it to other viruses as they mature, they tend to become highly more transmissible, they're like contagious, and start becoming less virulent. We're clearly seeing this. Immune system of the entire global world, which is because they were infected in the past or vaccination, is also showing signs that this virus is gradually showing its low virulence. But the question is still early on the grounds of what you asked me. Will we see another fifth wave? Will we see another sixth wave? Or will this completely disappear? Too early to say, but we're hoping what you just said, and we're comparing to what Spanish flu did, is this is the way of how the bell curve is. We saw the peak, and now it's this downward trajectory. And that is what we see ourselves in. And if this virus has started moving into the lower trajectory, which is highly contagious and less virulent, high chances this virus will slightly wipe out and become endemic in a very milder format, which is good for us to now believing that this is the time for us to start coming out.
Well, we believe in anything that gives us some hope. We really do, Prof. Thank you. Thanks for your advice. Thanks for always heeding our call to chat to us about this. Have a wonderful day and stay safe. Thank you.